Hi, take a seat. How are you? Good. Well, I'm Dr. Whispers and I will be conducting your annual physical exam today. Now, from my notes, I can see that obviously you're a new patient to the surgery, but at your last surgery, you hadn't had a checkup for quite a long time. Is that correct? Okay. Any particular reason for that? Oh, please, there is no need to worry whatsoever. Think of it more like a checkup. It literally just alerts us to any obvious health problems so we can deal with them nice and quickly. But it's just a general checkup of your health, so we'll check your weight, we will check your vitals. The nurse has already taken those, so we'll have the results back by the end of this exam. And it gives you an opportunity to ask any questions you have about your health and just give you a bit of peace of mind. Okay? Lovely. Right, so I can see from these notes that you are currently on some anxiety medication. Is that still the case? Okay, and how are those working for you? Good. Okay. And the reason you were taking them was just because of stress at work? Yes. Well, they're herbal medications, so they're not going to be too harmful, but gradually try to learn to not take as many within time, but obviously you have them if you need them, so that's the main thing. Good. Okie dokie, let me just make some notes here. Okay, so just try to relax. It's not going to take too long. So the first thing I need to ask you is, I'm just going to be checking for some moles, any sort of marks, unusual growths, anything like that on your chest area and below. So if you feel comfortable enough, could I ask you to remove your top and your bottoms and just leaving your underwear? So if you'd like to go behind the screen for me, is that okay? Thank you. Hi, just take a seat. Lovely. Okay, so I've just got a few questions. So question one, are you currently experiencing any pain, anything unusual? No? Okay, good. And are there any other symptoms or health issues that you have at the moment? No. Or some headaches? Okay, and how long have you been having those? Okay. And do you think the headaches are stress related, or are you looking at a screen a lot? Yeah. Have you had your eyes tested for glasses? You have? You're okay. Okay. I think the main thing is if you're using a screen a lot, it's difficult at work, but the main thing to do is to try and take regular breaks. So every hour, try and look away from the screen for about 10 minutes. And obviously when you come home at the end of the day, don't try and avoid going and straight looking at your phone and the television. Just try and give your eyes a bit of a rest, okay? Brilliant. And when you do get these headaches, do you take any tablets for them, or do you just let them go on their own? Yeah, paracetamol. Okay, that's fine. And do you find they work for you? Lovely. Okay, well, paracetamol is a pretty safe option. Make sure you don't take any more than 2 every 4 hours, okay? Lovely. And are there any other issues or worries that you'd like to get off your chest, or any questions you have about the exam before we get started? Lovely. Okay, you're a bit more relaxed now. Yeah. Okie dokie. Right, let me just pop on my gloves. So for this, what I'm going to be doing is just looking over your body for any unusual marks, just checking any moles you have. Okay, now before we get started, do you have any birthmarks or anything that I should be aware of? No? Okay. Alright then, do you want to stand or sit? Stand, okay. Right. And just turn around for me, please. Just turn back around. Thank you. Okay, lovely. So just a couple of moles in your back. Now, have you always had those? You have, okay. Main thing to look out for is any change in the colour, shape, and the size, okay? So if you notice any significant change, then just make an appointment and come and see us, okay? So it's just something to keep an eye on. Okay. Now, if I could ask you to just lay on the couch for me, on your back. I'm just going to check your abdomen, okay? Brilliant. Get yourself comfortable. Lovely, thank you. Is there any discomfort or tenderness there? No? Okay. All feels okay. Okay, lovely. Jump back down with me now. Just take a seat. Okay, that all felt completely normal. Okay, are your bowel movements normal? Good. Okay, so I'm just going to check your lungs now. Okay. Now, when I do this, what I'm going to ask you to do is just take a deep breath in and then out slowly, okay? Brilliant. And again. And again. And just one more time. Lovely. Can you just turn around for me, please? Thank you. And take a deep breath again. And again. And just one more time. Lovely. Nice and healthy sounding. Let's just take a listen to your heart as well. So just breathe as normally as you can, just try and relax. Lovely. Okay, so the next thing I want to do is just check your eye health. I know you said you've had an eye test, but it's just a really quick test, okay? So what I want you to do is just follow my finger, okay? Good. Now I'm just going to shine a very small torch into your eyes just to check pupil reactivity, okay? Lovely. Okay. Next thing I'm going to do is I'm just going to check your temperature using my ear thermometer. Okay. That's normal. Okay, you're doing really, really well. Okay, if you could just stand up for me and just take a step onto the scales. Thank you. Okay. Okay, so that's a stone difference between the last time you weighed. About 2 years ago you were weighed, so you're a stone less now. Now, is that something you've consciously been trying to do to lose weight? It is, okay. Well, that's brilliant because now your BMI is actually in a much healthier range, so really well done. Can I ask how you've been trying to lose weight? Oh, excellent. No, I've just got into tennis myself, so no, it's a fantastic all-round exercise. I think the great thing is anything that gets your heart pumping and, you know, get some good all-round full body exercise is brilliant. So, and the fact you enjoy it is amazing. And diet-wise, good. Yeah, well, I think it's all about balance, isn't it? And the fact you've lost a stone and you've done it gradually, I think is really, really good. So, well done. Lovely. Let's just check your height as well. So just stand up against the chart there. Okay, well you made it. That's it. So I've just got your results for your vitals. All came back normal, so blood, everything normal. I'm really pleased to see that you've been getting more exercise, and obviously you've lost the weight as well. Diet wise, keep it as varied as you can. Again, with the screen and the headaches, try and take breaks. And that is basically it. So if there's anything else you want to ask me, then you are free to go. Oh, it's a pleasure. No, not a problem at all. So if you do have any troubles in the meantime, just make an appointment and we'll see what we can do, okay? Alright, well you have a lovely day. Yeah, just straight through there. Thanks, bye bye.